From Italy this evening, it just gets worse. The death toll now worse than China, 427 deaths in just the past 24 hours.
With many European countries now on wartime footing, a haunting image today. The Italian military escorting coffins of COVID-19 victims out of the hard-hit city of Bergamo. Italy overtaking China as the country with the most coronavirus-related deaths. Italian newspapers are filled with pages and pages of obituaries. American tourists in Italy saying this could be coming to the U.S.
It's hard to imagine New York looking like this, but it was hard to imagine Rome looking like this before it happened.
With the number of infections in the U.S. soaring, in New York alone by 3,000 in just the last 24 hours, the mayor giving this new warning.
But the federal government does not do all in its power immediately. There will be people who die who didn't need to die.
Adding this is going to be one of the most difficult moments in the city's history. This as the White House is making an ambitious promise to fast-track medical treatments for patients with COVID-19.
It's shown very encouraging, very encouraging early results. And we're going to be able to make that drug available almost immediately.
President Trump touting the malaria drug chloroquine, or hydroxychloroquine, which doctors say have already delivered promising results in China to alleviate symptoms. But right now, the FDA is still studying the drug.
I think it could be a game changer, and maybe not. But I think it could be based on what I see.
The White House says another therapy for Ebola is already being tested on Americans with COVID-19, but it's still unclear when any of these treatments will be widely available or if they're effective. This as doctors and nurses have been sounding the alarm for days, saying they're running out of critical supplies. The CDC even recommending using homemade masks like a bandana or scarf as a last resort.
Nurses are working with inadequate protections, and that ranges from head coverings, respirators, eye shields, appropriate gowns.
But Vice President Pence claiming a company that makes those vital N95 masks is ramping up production to 35 million per month, adding that the government has now identified tens of thousands of ventilators as well. ER Dr. Stephen Anderson telling us they need ventilators in Auburn, Washington.
We need ventilators. I have ventilators this morning, but the hospital up the street from me is out of ventilators at the moment.
Schools, bars, and restaurants shut down across many parts of the United States. Medical workers are on the front line. Hospitals around the world now bracing for impact, facing a daunting uphill battle to meet demand with dwindling supplies.
So we have a huge demand from our clients, and they want to have more than we can supply at the moment.
And while Italy is in a state of lockdown nationwide, several hospitals in Rome are frantically setting up ICU and sub-ICU units to face the COVID-19 emergency plaguing the region. Back here at home, several hospitals preparing for the influx of patients by creating makeshift hospitals and curbside screen checks.
We knew that we'd be having an influx of patients who only need that level of care and that level of service.
Several hospitals here in the U.S. implementing stricter guidelines to use medical equipment, even canceling elective surgeries to help prepare for the influx. New York City Health and Hospitals Corporation and New York Presbyterian Hospital, two of the biggest hospital systems in the Northeast, planning to cancel those procedures in the coming days. New York Governor Andrew Cuomo announcing today that the state needs between 55,000 and 110,000 hospital beds and between 18,000 and 37,200 ICU beds. Currently, New York has 53,000 hospital beds, 3,000 ICU beds, and 4,000 ventilators.
The growing pandemic now revealing the risk for young people may be worse than previously thought. New numbers from the CDC showing nearly 40% of American patients hospitalized for COVID-19 were between the ages of 20 and 54. Still, thousands of college students have been descending on Florida beaches. But 29-year-old Tarek Soleiman wants young people to realize just how dangerous it is. He's sick with the virus and has pneumonia, unable to breathe.
I just want to say that it can come to anyone, and it can also be severe for a lot of young people.
The governor of New York today leaning on his 22-year-old daughter.
What is the one line I used to say?
Risk reward.
Yeah.
to urge young people to heed the warnings.
These pictures of young people on beaches, these videos of young people saying, "This is my spring break, you know, I'm out to party, this is my time to party." This is so unintelligent and reckless.
In New York, Governor Cuomo now tightening the restrictions on businesses, mandating that 75% of their workers must stay home. And in nearby Freehold, New Jersey, an unimaginable loss for the Fusco family. Today, the fourth member of the tight-knit family dying, all within days of each other. 3 others hospitalized, nearly 20 family members now on quarantine.
What is it like to try to provide the services you do when there is an invisible and currently largely undetectable pandemic moving through the population?
So there's already an underlying crisis of homelessness in California, in San Francisco, and it's a crisis that it's persistent and challenging and hard to deal with on its own. When you layer on top of that the coronavirus and its potential to harm the most vulnerable among us, we're really looking at a potential catastrophe in the Bay Area. They're also more likely to experience that. They're close quarters. They're living with a lack of hygiene and sanitation at their disposal. They have all sorts of vulnerabilities that make them more likely to both contract, suffer from, and transmit the virus.
Coronavirus outbreak, and we're here to answer some of your biggest questions about when will a vaccine be available. So let's get started. So how do vaccines work? A great question. Vaccines help your body build immunity to specific infections by using an imitation infection. That produces the right blood cells and antibodies to fight off the virus. When imitation infection eventually goes away, well, the body is left with memory white blood cells. Those know how to fight the strain of the virus away in the future. So how long until a coronavirus vaccine is available?
It would take then about a year to a year and a half to be fully confident that we would have a vaccine that would be able to protect the American people.
That's because it takes a significant amount of time to create potential vaccines and then test them extensively to ensure they're both safe and effective. Obviously, right now, we don't have a vaccine yet, but it is in the works. In fact, there are multiple in the works. The World Health Organization held a briefing on March 6, 2020, where the Director General announced that they alone received 20 applications for the purpose of vaccine development.
Yeah, I had the vaccine yesterday at 8 a.m. I'll have a couple follow-up phone calls today and tomorrow. I'll go back in next week for a blood draw, and a week after that for another blood draw. 4 weeks from yesterday, I'll go for the second vaccination and then repeat those steps for the next 4 weeks.
That was Jennifer Howler. She was the first person to be tested with the COVID-19 vaccine on March 16th.
In this theatre of war, the heroes hardly rest. Brescia in northern Italy is seeing one of the highest rises in daily cases. The hospital is overwhelmed, but resilient.
There's a strong commitment from all doctors and nurses. Sometimes they come in even when they're not on shift, or after they're on at night, they come in the morning after to help us out. Some of them have cried, but I've never seen anyone complain.
More than 8% of cases in Italy are medical staff, almost double that of China. The 13th doctor died today. One of the patients here is a doctor, she says, born in 1982. He was in the emergency room, fell ill and tested positive. Now he's been intubated. Thousands of medics are being recalled from retirement and rushed in from university to help, but still they're desperate.
I think our hospital is reaching breaking point. We don't just need more beds, but we need workers. We need equipment to protect our staff. We need ventilators. The spread of the virus is too fast for us to keep up.
In this outbreak, not even the dead are left in peace. Overnight, the military moved coffins from nearby Bergamo to other areas to ease pressure on bursting crematoria. From one town that's cut cases to zero through mass testing and quarantine, a warning to Britain over its slower response.
I feel very, very sorry because I've been living in England with 25 years and I left my wife and my son there. So for me it's very sad to see that they're doing exactly the same mistake that they did in Italy. Well, it will lead to an outbreak which will be the same size or even worse the one that we are seeing in Lombardy.
Restrictions on movement here are now set to be extended, with most venues remaining closed and schools shut well into April.
What is the process of finding a vaccine and who is involved? Vaccine development starts with years of work in the laboratories of research hospitals, universities, and biotech companies, as well as the National Institutes of Health, which contributes a lot of background research. Larger pharmaceutical companies then pick up promising developments and begin the process of running 3 phases of clinical trials. That's where the Food and Drug Administration, the FDA, comes in. They are responsible for approving the initial application to begin vaccine development, and they set strict guidelines for the clinical trials. FDA rules require a third party to sponsor the trials, which means they choose the research institutions that carried out the testing and make sure the FDA guidelines are met. Often this responsibility falls on the NIH. During the first phase, the vaccine is tested on less than 100 healthy young volunteers. The researchers are looking for serious side effects. The second phase increases the pool to a few hundred volunteers, and the third phase tests thousands of volunteers to test the true effectiveness of the vaccine at preventing the disease. Once the vaccine has been thoroughly tested and licensed by the FDA, a team of medical experts from the CDC called the Advisory Committee on Immunization Practices reviews all the data from the months of research, development, and testing and determines how the vaccine should be administered, who should get it, and what risk factors are present. Together, the CDC and the FDA continue to monitor the effectiveness and safety of the vaccine for as long as it's in use.
And I've directed the FDA to eliminate outdated rules and bureaucracy so this work can proceed rapidly, quickly, and fast.
So what is the state of the race to develop a vaccine? Well, we are still pretty far away, but at the moment, several pharmaceutical companies and private bioresearch firms are working on vaccines and treatments, and a few of them are pretty far along. Leading the pack is Moderna. They've already sent a batch of their vaccine to the NIH's National Institute of Allergy and Infectious Diseases to begin the first round of clinical trials this month. Moderna's vaccine works differently than traditional vaccines. It injects nanoparticles with genetic instructions that tell the body's immune system to attack the virus. This makes it faster to produce, but this type of vaccine has never been licensed for public use before. Gilead Sciences is another company at the forefront of the fight against COVID-19, but it isn't focusing on a vaccine. Instead, Gilead is testing an existing antiviral treatment to cure patients who have already contracted coronavirus. It's called Remdesivir, and it's already being used by doctors in the US, Italy, and China to treat patients with severe cases, and promisingly, one patient in the US has recovered after being treated with Remdesivir. In terms of conventional vaccines, it's anyone's game at this point. A host of pharmaceutical companies and biotech firms have begun development on coronavirus vaccines, but many estimates don't have them beginning human trials until the end of the year. So what to take from this? Well, a vaccine isn't going to be the magic solution to this pandemic. Scientists will undoubtedly develop one at some point, but it's going to take time. In the meanwhile, you need to do the things you need to do to stay safe. That means washing your hands, having social distance 6 feet apart from each other, and staying home if you're sick.